Hello. I will now sing a song about excessive anxiety disorder. So, excessive anxiety and worry is a thing. If occurring for at least 6 months, let me tell you what it means. Generalized anxiety disorder isn't very cool. And if you want to understand, let me show you a good tool. Well, you may be worried over very simple things. A catastrophe is waiting, let me tell you what I mean. With no specific fear, it's worry that you cling. You might just end up having chronic GAD. Restlessness or up on edge or easily fatigued. If it's difficult to concentrate or find it hard to sleep, now we must be moving on, so now let us proceed. These are just some symptoms of chronic GAD. The anxiety or worry causes significant distress. It impairs your social life or important areas. The effects of substance drug abuse is not the direct cause, or medical conditions are also not the cause. Now you must realize to know it's no specific fear. You could worry of the weather or the splinters in your chair. You could worry of your passing grades or your neighbor's dog. Now let me tell you some good reasons that just might be the cause. Your superego and your id are battling a test. Autonomic restrictors make you respond so much less. Cognitive behavior is also what it seems. People tend to see more danger in the smallest things. Now we have some causes of this GAD. I've mentioned all the symptoms just to tell you what I mean. What about the treatments, wherever they may be? How can we help all those with chronic GAD? There are several different ways to treat GAD. You can take some pills such as benzodiazepines. If you don't feel like being physically impaired, then psychological treatments will treat you so much fair. Thank you for listening to my song about excessive anxiety disorder, also known as GAD. But to clarify, let's look at diagnostic criteria for those with GAD. In order to have GAD, you must have excessive anxiety and worry in a general occurrence for at least 6 months. This disorder is not a specific fear to something, as it can be events such as work or school. Some of these symptoms include restlessness or feeling keyed up or on edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, or sleep disturbances. Although the anxiety and worry can be associated with just 3 of those symptoms. These disturbances are not due to the direct physiological effects of a substance, such as drug abuse or medication, or general medical condition such as hyperthyroidism. Approximately 3% of the population meets this criteria during at least 1 year period, and almost 6% at some point during their life. About 2/3 of those with GAD are female. It is most prevalent among older adults around 45 years old and least prevalent in those between 15 and 24. A few causes for this disorder include psychoanalytical and biological, the unconscious conflicts between the id and superego, and those with GAD respond less physiologically than normal people do. There are psychological treatments such as relaxation training, assertiveness training, or cognitive behavioral therapy. There are also biological treatments. Benzodiazepines are often prescribed, but they risk impairment of cognitive and motor functioning. Studies have shown that benzodiazepines and psychological treatments seem to work the same in the short run, but psychological treatments are more effective long term. Thank you.